What is the role of government in the medical care field as in other fields? To enforce laws against fraud and deception, to help people who are in dire distress. There is an argument to be made about the fact that some people may not be able, on some occasions with emergencies, to stand the very large major medical bills. Just as some people may be in dire distress because they lose their homes with a flood or a hurricane. Some people may be in dire distress because they become disabled or otherwise. Insofar as the government has programs to assist people in dire distress, it ought to include people in dire medical distress. But I think there is no other special role. For ordinary medical care, there is no case for government financing at all. The costs of ordinary medical care are well within the means of the average American family. And the problem of sometimes it's being large and sometimes it's being small is currently readily handled through the availability of private insurance arrangements. 80% of all hospital bills today are being paid through third-party payments on insurance. I have no doubt that those insurance arrangements could be improved. I have no doubt that they will. This is a field in which innovation is still going on. I myself believe it would be desirable to have greater major medical coverage, to have larger deductibles, more co-insurance arrangements, and other devices. Those are details. They can and will be improved. But insurance enables every family in the United States, except those who may have to be on the public purse for other reasons, to provide for its own medical care. Let me point out that although the private expenditure on medical care has been growing as a percent of income, as people have become more affluent and have wanted to spend more of their money on medical care, yet total expenditures on medical care is less than 2/3 as much as total expenditures on housing. It's less than 3/4 of total expenditures on automobiles. To put the comparison another way, the people of the United States spend on making themselves unhealthy by purchasing cigarettes and alcohol, which the medical evidence is overwhelming that that's not a way, that's a way to increase your medical bills, not reduce them. And I'm not objecting to people doing that. It's people ought to be free to hurt themselves as well as to help themselves, so long as they do it at their own expense. But the American people are spending on tobacco and alcohol a sum of money each year which is 40% as much as they are spending on medical care in total. So we are not talking about sums that are beyond the capacity of the individual family at all. In my opinion, the major problems which we now have in medicine are the result of government involvement and not an excuse for additional government involvement.